Welcome back, everybody, to another edition of Disruptive Dental Science. My name is Dr. Ashton Prince, and I am one of the clinical ambassadors here at Dental Advisor. And I'm once again joined by my good friend, Dr. Adam Hodges. Adam, once again, it's nice to see you.
Yes, sir. Ashton, good to see you, and thanks for having me on.
Absolutely. For those that were not able to join us on our last episode, if you wouldn't mind, tell people who you are and where you work.
So my name is Adam Hodges. I'm in Asheville, North Carolina. I'm a general practitioner. I practice with my brother, formerly with my father. Went to dental school in Georgia, went to residency in South Carolina, and was incredibly fortunate that early in my career, I was involved with some really, really powerful and high-end dentists that taught me a lot and inspired me to be a better dentist. So what I was seeing in them is what I wanted to be. And then what I had the forethought to do was to ask them, "Hey, how did you do that? How'd you do what you do?" And the common thread that I kept hearing was around continuing education. So early in my career, when I really couldn't afford it, to be frank with you, I went down to the Pankey Institute and Spear and LSU Cosmetic Continuum, learned a lot about dentistry, and began my journey that's evolved now to 25 years into practice, and really just enjoy dentistry and have a great time.
25 years you've been doing this. You don't look a day over 40. No,
Clean
you
living,
said
brother. Clean living.
it's a good route to go. What I found entertaining there for a second is that you said that you really couldn't. Well, that the phrasing that you used, couldn't afford to go through and try and get that continuing education, that further learning. I always said when I was going through school, and for those that were trying to go through it, go through dental school, get your degree, learn how to become a dentist afterwards. There's a lot that is taught to us that we are just spoon fed constantly information, different protocols for things, different processes, different materials. I mean, there's so much that is thrown at us that when we come out of school, it's almost difficult to try and figure out now, how am I going to do this? Now, you said you were lucky enough to be able to work with family and see that that was kind of the direction that you wanted to go. The how they were doing things you were starting to notice. But I'm curious if there was anything else that you were starting to visualize for yourself, because there were, just to preface this just a little bit, I, I I went through a number of offices myself, and you can say that I shadowed. I was actually looking for a job at the time, but there were a number of things out of certain offices that I really liked how they did things, and there were other things that I really did not like. And so I thought, what I'm going to do for myself is I want to go from office to office, and I want to take the best of things, and I want to implement that into my own office. And those items that I can see that are just not as good, I'm just going to make sure that I'm going to avoid all those issues. And it started to get me into a different mentality. So for you personally in your own private office, you understand at this point, 25 years into your practice, how to do things. But as you and I have discussed in the past, that's not the only thing you have to consider, correct?
Yeah, I mean, I think Frank Spear says it best. And to get back to your statement, he says that when you graduate dental school, you graduate a safe beginner. And so
Good point.
early on in my career, I kind of lived by the philosophy of what I call dig jam. Damn, I'm good. Just ask me. And the reason that was important is I lived it that way because I didn't want to be, I kind of had this insecurity. I didn't want to be found out to be a fraud. So if people asked me questions, I felt this obligation to answer questions. And as I evolved, what I learned is the word I don't know. Because when I don't know, I now say I don't know all the time, but I'm very comfortable knowing that it's okay not to know the answer, especially as a young dentist. So I
Absolutely.
think part of what I got from a lot of these people early on was just a zeal for trying to understand the problems we see, and then also being mentored to understand the problems we see, because I would see things and I didn't understand what was going on. And I had these conversations and they would open my eyes to a different line of thinking. And then as I said, "Hey, well, how'd you figure that out?" I kept hearing the same names. And that's got kind of spurred me on to begin that journey, because until you put a tool in the tool chest, and the analogy I'm using here is tools or knowledge or education, until you put that tool in the tool chest, you can't use it. So the sooner you put it in your tool chest, the more you can use it and the more it has a return for you and the quicker you grow. Traditionally, a lot of people who are in continuing education continuums long term were older people. Now I think there's a lot more younger people going through, which is fantastic, because if you wait until the end of your career to learn it, you have very little time to use it. If you
Sure.
get it early, then you've got the ability to use it in your practice, which I think is very important to having a fruitful and productive practice long term.
Yeah. You've been doing it now for 25 years. I haven't been doing it quite as long. I'm only at 17 years,
Rub it in.
but at the same, I'll do my best to. Yeah, that's part of my job is to rub that in. But there's there's a there's a moment that we come to in our careers, and for those that are still fairly young, I'd say young in my eyes for a dental career would be within the first 5 to 6 years. If you're within those first 5, 6 years of things, then you're still learning quite a bit. It's after that that you really start to get comfortable with what you're doing. Your confidence level is starting to build. You really understand what it is that you're doing. And it's not just that you're doing it, but you're understanding why you're doing it. And it's a different type of mentality that you actually have when you're actually understanding things a little bit differently. Now,
Yeah.
for you personally, you've kind of led into the why. So explain that to me a little bit.
So one of the things I listen to a lot of podcasts. I mean, obviously not just this one, but a lot of podcasts. And one of the things I used to watch a lot was Simon Sinek. I don't know if you've
Yes,
heard of him. So
absolutely.
one of the things he says all the time is people don't buy what you do, they buy why you do it. And he says it over and over again. People don't buy what you do, they buy why you do it. He uses Apple as an example. One of the things about that really resonates for me is early in my career, you don't know what to do with patients when you're in there. And you're not really, unfortunately, we're not really taught really well how to communicate with people. So what I realized, and
So
especially when he
true.
said that, is people don't buy what you do, they buy why you do it. Okay. So during my conversation with patients and in general in our office, I like to tell my staff the radio station in this office is all teeth all the time. And the reason it's all teeth all the time is because you can't judge me for talking about teeth. Now, you can not like me, you can be bored out of your mind, but you can't judge me for it. If I get into any other conversation about politics or religion or any of the things or what I did last night, you can interpret that however you want. But most of the time, I can't interpret the dental part of it. So I try to keep it always focused on dentistry because although patients might not understand it, patients want to be in the hands of a person who loves their craft.
Yeah.
If you say, "Hey, dentistry's, I really don't enjoy," and then, "Oh, open wide," I mean, that doesn't instill confidence. So what you want is, and let's say, for example, today I'm having a conversation. You're in my chair, and I'm saying, "Well, my wife and I went out for dinner last night, and we had dinner, and then what, blah blah blah. We go on the rest of the night, and the patient's sitting and having a crown. Let's say tomorrow the patient has sensitivity from a crown for whatever reason they have it for. The patient's going to begin to interpret what happened, and they're going to say, he was talking about going to dinner with his wife. Most people maybe had a drink, probably had a few drinks actually, this guy. And then I bet he was drunk. He was probably hungover. He didn't do it well. He cut into my nerve. And I know that's what happened. And now this becomes the Google review
Oh,
that you get
100,
for this
100%.
thing. So what I do is I say, hey, listen, we're gonna go into this tooth. This filling's kind of deep. It's close to the nerve. I'm gonna try to keep you from a root canal. We're gonna put some medicine down here. It's possible you might have some sensitivity tomorrow, but I'm trying my best to help you keep from a root canal to have further treatment. Whatever it is you want to say, but all teeth all the time allows them to say, he told me about that. He told me it was deep. He was trying hard to keep me from the root canal. This thing's sensitive. Hopefully this doesn't happen in anybody's practice, but this analogy is just to say, then they have an understanding. And then when they call back, they say, Dr. Hodges said that I might need a root canal. I feel like it's getting sensitive. I think I'm going to need that root canal. So it's a different experience in the way that they interact. And when patients get up all the time, they say, listen, thank you for explaining to me what happened. Because for a patient, when they sit down, this is the scariest show they could go to. So some of these patients are scared out of their mind. It's like going to a haunted house. Here we are coming up on October. It's a haunted house. So what I try to do is I walk them through their haunted house. So I say, hey, listen, I know, like, let's say we're going through a haunted house. I'll say, well, around the next corner is a really scary clown. Actually, this is George. And George has a chainsaw. There's no chain on it. And actually, George loves to do this. He's going to try to scare you. Don't worry about it. And then when George comes out, they're fine. If you can keep their blood pressure down and them comfortable, the experience for them is totally different. It
Yeah,
passes quicker, they do better. So that's the thing I'm trying to do for patients.
beautiful. There, I was taught a number of years ago the the expectations that a patient actually goes through, what they have in their mind, what they are actually expecting out of the treatment that goes on. Uh, it was just this past week that I had a patient that I actually even asked, now, do you want me to explain everything that I'm doing throughout this entire process, or do you just want me to shut up and just get this done so you can get out of here faster? Now, most of the time, They will say, I'd like to have you kind of walk me through it to make sure that I understand what's happening. But occasionally we do get that one person that says, I just don't want to be here. I don't like being here. I haven't slept in 3 days because I knew that this appointment was coming up. If you can just get me out of here as fast as we possibly can, then that'd be fantastic.
Right.
When it comes to how we treat each individual patient, for me personally, customization is the only way to go about this kind of thing. Now, to be able to do that, you have to be able to read people a little bit.
For
But
sure.
when it gets back to that expectation, what was taught to me was E minus R equals C. So the way that that breaks down is it's expectations minus reality equals conflict. So when you have a certain expectation and then the reality does not match up to that, conflict arises. Now, in a dental chair, for those that are coming into the office, usually that conflict is anxiety or nervousness or the expectation that something terrible is going to happen. So when you are discussing things with people, when you are actually sitting down, whether it be knee to knee, side to side, both looking at a screen, going through things, patient education that goes on, us trying to minimize the fear that people actually experience and have, it's a skill. But I would dare say that is a skill that can be learned. Do you agree?
Yeah, I would totally agree. I think that the more you practice it, like any skill, the best athletes are the ones who practice the most.
Mhm.
So if you want to get good at a skill, you've got to practice it. If you let your staff members do it, you won't get as good at it. So, and a lot of it to me also is patients are trying to read what your motivations are. So, for example, when I give a patient a treatment plan, I say, listen, my job is I have a responsibility to tell you what's wrong. I'll try to classify it into urgent things and things that are preventive and all this. But the reality is, I'm going to tell you what's wrong. Whether you do it or not, it's really up to you. And if you do it or not, we're still friends. I don't mind. If you do nothing or do everything, it's great. Whatever you want to do. But I'm just telling you, it won't change. So if you come in next year, it's the same. And if you don't do anything and you have pain on Saturday night, please don't call me because and they will, and I'll come in because I'm that guy. But I try to say, listen, I'm going to tell you what's wrong. If you don't want to do it, that's on you, and
Uh-huh.
that's your choice. I'm not making judgment. I'm giving you the facts of what's going on with your mouth. As we get into salesmanship, I just don't think dentists are really good at that because really good salesmen practice it a lot. And whenever I've been sold in my life, I don't realize until after it's happened that I was sold. I'm like, I really like. Wait a second,
Like,
that
what
guy.
did I just sign on to?
What is that? And so for a lot of this, that's what I'm. I don't think we're trained to do that. I don't think we're good at it. So I don't think you should try to be a salesman. Like, oh, if you'll buy this treatment plan today, we'll give you 5% off, and we'll give you 2 toothbrushes, an electric toothbrush, and a free whitening. Don't do that because then it just cheapens the entire thing. It's like, hey, just hold the line. This is what you need. This is what it costs, and let's go for it.
Now, hold on for, are you the one that's actually talking finances with your patients?
So I don't
Please
I
tell
think
me
it's
no.
well, no, I am certainly not afraid to say to them because I think when you could say, hey, listen, when they say how much is your crown, that's 1387. And I because if you can't because I say, well, they'll talk to you up front. What that means is, I mean, now again, this is just philosophically. As you can
Oh,
see, I'm a blabbermouth. I like to run my mouth, so it may not be that's very confrontational for some people. But for me, when I ask you, like if I go have something to buy and I say how much is it, and you say, well, wait a second, let me get this other person to see how much it costs. I'm like, well, how do you not know? You do this every day. How do you not know what your stuff costs? And
yeah.
so for me, I say let's 1387, and it's probably going to need a build up, and that's another $300. And they say it's expensive. I say, yeah, it's expensive,
Have you ever
but it's
actually compared to what? Have you ever had that conversation with somebody?
well, and they say, well, you have all these conversations, and I think depending on what you're doing, so it's different for every dental office.
Yeah.
If you're trying to run a practice in a very competitive environment and you have to take a lot of insurance, those conversations may be quite different than you. I'm a just full disclosure, I'm a fee for service practice, so I feel like my practice has to be more boutique like because if they're going to pay and not be insurance related, then I've got to be able to give. Now we still file insurance and we accept that portion that they have to pay us the portion the insurance doesn't pay. But I feel like there's a certain amount of service that needs to happen. If you go to a restaurant that's really nice, you expect a certain level of service. So I'm trying to equate myself to that so that when they come in, they feel like the service that we give them is worth potentially the extra fee they have to pay to get that service.
I'm going to call you an anomaly for a moment because I would have to assume that the vast majority of people that are out there that are listening to something like this, if somebody asks them, how much is this going to cost? I have to assume that they start to cower back. They start to, for you, 1387. will be what you'd be able to say with confidence. You know that's what you're worth. You know that that's what the actual value is in the product that you provide. But for others that aren't quite as confident in what they're saying and what they're doing, then it could be, well, it's 1387.
Right.
Is that okay? Do we need, would it help if I took 10% off of that? Would that be more sufficient for you? It's the quickest way to weaken the value of what you actually do.
Yeah, and I agree. And I think part of that is you have to practice that skill. For sure, if you're not as comfortable with that conversation with patients, and that's okay if you're not, especially if you're younger and the patient's older, maybe you do pass it off. But I think you'd also practice that skill to say, hey, listen, be confident. And, dentists have this challenge. We feel horrible for patients. We want to help them out. So we'll talk ourselves into all these discounts. Other professions, if you say to a lawyer, how much is your fee? $400 an hour. If you call me, it's $500 an hour. And if you do this, it's $600 an hour. And it's, and I'm not saying we should be like that. I guess what I'm saying is patients buy why you do it. So if I say, hey, listen, this is the fee. Is that expensive? Yes, it is, but it takes a lot of work and I'm sending it to this and I'm not compromising for you. And for that, if they have a problem, I'm going to take care of it.
Yeah.
So, I think the responsibility is if you are the type of dentist who, if you're working at the bare minimum and you're surviving, then maybe that kind of service is not, because you're probably working a lot of volume. Maybe that service is not what you need to provide. If you're, and there's nothing wrong with that. I like Walmart. I like everything, but the question is, how are you doing it? So however you do it, your service needs to match what you're pricing at. So for that pricing, if you call me on a Saturday night and you're my regular patient, I will come see you. Why? Because I value that relationship.
I would dare say that it infuriates me that in the dental industry that we have gotten ourselves to negotiations. That just like you said, if you're going through, I'll even take it to a grocery store. If you go walking through there, you present all your groceries at the cashier. You're not at that point negotiating down the price of what you just paid for that, that loaf of bread and that gallon of milk. It's just not how it happens. But in
I'm buying
dentistry, for
four
some
gallons of
reason,
milk. Can I get a discount?
that's exactly it. You're like, how did dentistry get to something like this where we all of a sudden have to almost prove ourselves that we are worth what it is that we say that we are worth?
Well,
Any
and
opinion there?
no, I agree with you. And I think a couple ways to look at that. One way is, if I've been to places and lectured where it was like, hey, the average crown price is $800, and that's what they're getting from insurance. And in those environments, you don't have a margin, that you're on really shallow margins. You've really got to hold the line there. But let's say that that's not the case, and you're charging a lot of money, then you need to have that service match that. And I think you don't need to give bargains, but you need to make sure that your service is matching that the crowns you put in, you're spending the time. I do feel like the public has a right to scrutinize that and say, hey, what are you who you say you are? And you're like, yes, I am. I am the dentist you want to see. And for that comes a fee. Now they always say, well, I could have it somewhere else. I say you can, and I don't have a problem if you go there. I really don't. So if you want to go there, I understand. I'm with you. If there's a problem, I can still be your liaison. Taking it personally is part of the problem, is that some people just can't afford it. It is
Yeah.
now, if you ask the average American for some of the fees that we charge for things, it's more than their budget can afford. And I
Yeah.
understand that. And I'm willing to help those people find a better solution, but they all want the best for the cheapest money. I get that too. But I'd say, well, these aren't things we bargain with. Now, if it's a big treatment plan and there's this kind of terms or whatever, sometimes we'll make, little deals there. But in general, I don't deal with the pricing of things day to day. It's just too
Yeah.
complicated.
Well, the more that you do that, the more you're actually training your patients to expect those styles of discounts and things. That if I hold out for long enough, maybe I can get Dr. Hodges to knock this down by a couple $100. You've got to be very, very careful with how you, and I will use that term again that I don't like at all, negotiate the terms of the value of what you do. Now, you said it is one of my favorite books that Simon Sinek does. It's the Starts with Why. He talks about the golden
Yeah.
circle and that how you have to work from the inside out, of really establishing yourself. So you said it just a second ago that you kind of start with the why it is that you do what you do, which will then explain why it is that a patient should value that much more into what it is that you're doing. So when you say that you have a why dynamic, and you said just a second ago that this was that you really valued the relationship of your patients, and because of that, you're going to stand behind the products that you have. and it should hopefully allow for these patients to feel much, much more comfortable,
For sure. And I
relaxed
think
in what you're
we,
doing.
well, when you talk about the golden circle, they talk about, a lot of companies talk about, we have the best product, we have the best computer, we have the best whatever.
Yeah.
And then his analogy is always Apple, where they say, this is our philosophy. So, when it comes to dentistry, I don't want to necessarily get rah rah about philosophy, but I would say, I want to do dentistry to the highest level that I'm capable of doing.
Yeah.
And it's important to me to provide for you a quality result. And if I'm not doing that, I need you to talk to me, and you need to allow them to have that conversation. And when they start to understand that, I mean, a good analogy, have you ever heard somebody say, Doctor, let's talk about this shoulder surgeon. Yeah, he's got a horrible bedside manner, but he's a great surgeon. So the reality is, patients will let you be not as nice a person. I'm not going to say bad words, not as nice a person, but they want you to be good at what you do. So now some dentists are amazing speakers and people form great relationships with them, but they're not great dentists.
Right.
And so those people are very successful, and all the other dentists in town are like, I don't know how Dr. Jones does it. He's not very good, but people love him. The idea is to be both, to be comfortable. And if you don't like talking to people, just talk about dentistry,
Yeah.
because that's what they're there for. Hey, listen, we're going to put this bonding agent on your tooth, and you're going to notice a smell because I'm drying it off, and you're going to smell some ethanol. What it does is it substantiates for them that you care about what you're doing, that you're going through the steps, and it also helps you remind yourself to do the steps. So I do that a lot. Whereas I'm doing the procedure, I go through the intricacies of the procedure. It just stops the dead air from happening, but it also builds confidence and trust that I know what I'm talking about. Even if I don't, they at least appears that I do.
Fake it till you make it.
That's right. And that's a good way to look at it. So that inner circle in the inside is talk about, why do you do this? Why is it important
Yeah.
to you? If you talk about everything but dentistry while they're sitting there, they're going to think you care about everything but dentistry while they're there. That's the important message.
So how do you get somebody to understand their why? For those that are listening, Dr. Hodges, how can you explain to somebody the process of understanding their why?
I think you have to look inside. It's amazing to me. In dental school, I'm amazed at how many really, really smart people I was surrounded by. In my dental school class, there was some brilliant people in there, and I would say I was middle of the road in that group. But something happens when we grad, and they're all capable. They all made the grades. They all were able to graduate. They all showed proficiency. But somehow, 25 years in, I talked to some of my classmates, and they look beat. They look beat down. So as that people think about their why, I would say, part of the challenge is we work in the mouth, which is a small environment, on teeth which are small, and holes in teeth that are smaller. And if you're doing a root canal, holes inside the tooth that are even smaller. So it is a very intricate procedure that can cause you a lot of stress, but you have to balance that. And I would say that you think about, why do you actually want to do this? Is it to provide for your family? And that's an important part of it. But
Mhm.
it's also, what is it that challenges you? As you get up in the morning, find something that challenges you to say, hey, I'm going to do this well today. Even if you've never done it well before, focus on it today, and then work and repeat and work on your scripts. So I talk a lot about scripts. As you walk in with people, develop a script that you refine. So every time somebody has a counterpoint that goes against your script, then you alter your script to get better. And then as you develop over my practice, I've got things that I say that answer every question they're going to have, because I all the holes that have been drawn in my argument, I keep filling the hole. So look inside and say, why do you do this? Why is it important to you? You've devoted your life to this. You're a smart person. You've done really well. How do you find that satisfaction so that every day when you go to work, it's rewarding? And even if you find one thing, it may not be your staff. It may not be this thing over here, but find the thing that's important and then focus on it. And if you can, and you're pointing your career where you can, then do more of that. If you don't like doing these things, and you're successful enough that you can only do this, then focus on just this and get good at that
Yeah.
instead.
Well, a lot of times I've heard it referred to as core values, the things that you value the very most, and understanding why it is that you have the core values, the things that drive you to do what it is that you do. Whenever I'm trying to find, let's say, a new team member, then when they come in, then one of the first questions I ask them is, why dentistry? Why in the world would you want to get into a field like this, where people don't like coming in the first place? They don't like the pain. They don't like to pay for what they just had done to them. And a lot of the times it's the worst experience of what they actually have had, at least in their mind. Obviously, as clinicians, we try and change that. But I'll ask them, why is it that you want to get into this? And most of the time, the answer that I guarantee you've heard as well is, it's because I want to help people.
Yeah,
That will only get you so far.
correct.
That's not really what wakes you up in the morning and says, I just want to help a few people today. There's a lot more to it, and everybody's going to be a little bit different. So I'm going to have a different opinion of what my core values are. Adam, you're going to have opinions to what your core values are. But when you can get a team that can start to form as to why it is that you as a team come together in the way that you do, you really start to develop something absolutely fantastic and beautiful.
No, I totally agree. And I think that, dentistry is a service industry. And it's unfortunately sometimes a thankless service industry because people don't really want to be there. So you want a team that rallies around that to understand that it's not personal. When people have problems like this, it's not personal. You're seeing patients at their worst and they're most scared. And it's really nice to just be nice. Patrick
Yeah.
Swayze in Roadhouse said the best, just be nice, no matter what happens. I won't repeat the rest of what he said because there's some bad words in there.
That's
But
that's a good call.
but the theme was just be nice, no matter what happens. And that's kind of the philosophy is no matter what, somebody says, hey, you're just not a nice guy. I'm like, I'm sorry, I'm not a nice
Yeah,
guy. Tell me how I can be better. Rather than being confrontational. So especially in this environment, just give them a pass on the fact that it's not their easiest environment. Find joy in your life and your profession and find things that interest you and don't harp on the negative stuff. Don't let it get you down because so many people let it get them down and then it really affects their life at home. You've really got to
absolutely.
balance these things out so that you don't take it home and affect your family because that has long lasting effects for you as a person and on your psyche. So you really got to just balance and leave that bucket of what happens at work and make sure that you understand it's not personal.
Buddy, I could not have said it better myself. Beautifully, beautifully said. Well, Dr. Hodges, thank you once again for being a part of this with us. Your insights are phenomenal. For those that are looking for their why, just look a little deeper, gain the confidence level that you need, improve the social skills, connect with your patients, as Dr. Hodges has said, in a very, very beautiful way. And if nothing else, just be nice. So, Dr. Hodges, thank you once again for joining with us.
Thanks, Ashton. Always a pleasure, man.
Absolutely. And for those of us from Dental Advisor, if you want to view a little bit more of what it is that we do and who we are, go to dentaladvisor.com and look at some of the evaluations and things that we've done and some of the companies we've been able to associate with. But for those of us from the Disruptive Dental Science podcast, thank you for joining us once again. We'll see you next time.